Good evening and welcome. I am Dr. Jeffrey Sterling, the Surgeon General for Alpha Phi Alpha Fraternity Incorporated. On behalf of our General President, Brother Willis Lonzo III, it's a pleasure to be with you. This evening's topic is something that's rather solemn, and I know that it has probably touched all of our lives. In fact, each year in the United States, about 255,000 women get breast cancer. Approximately 42,000 women actually die from it. Now, this doesn't just affect women, it also does affect men. Men get breast cancer, but only about 1 of 100 breast cancers diagnosed in the United States is in a man. I have a personal experience with this. My father-in-law actually succumbed to the consequences of this. So this is something that both men, women, and those who care for each other should be aware of. For every 8 women in the United States, 1 will be diagnosed with breast cancer during her lifetime. And for men, it's about 101 in every 833. So tonight's topic is very important, and we welcome back as tonight's moderator, Alpha Phi Alpha Deputy Surgeon General for Family Health. Victor Narcisse III is a spring 1990 initiate of the Rho Iota chapter of Alpha and is currently active in Alpha Eta Lambda chapter. He practices at the Houston Methodist Hospital as the Associate Division Head of Hospital Medicine, and he is the Director of Clinical Research in the Division of Hospital Medicine. Dr. Narcisse is board certified in internal medicine and in geriatric medicine, and he is a fellow of the American College of Physicians and the Society of Hospital Medicine. Brother Dr. Narcisse, have a great show and look forward to hearing it. Thank you.
Good evening. We bring this topic to you because it's Breast Cancer Awareness Month, and many of us have had breast cancer touch our lives. I've had members of my family, one of my cousins died of breast cancer when she was only 40. But we wanted to bring this topic to this group because there are things that we think that men need to know about breast cancer. And that's something that doesn't get addressed enough. One of the topics that you've heard about briefly tonight is that men can get breast cancer as well. So we're going to speak about this very, very briefly and hopefully provide some information that would be useful in your quest for health, but also because of the relationships that we have with the women in our lives, whether they be our mothers, our sisters, our wives, our girlfriends. So many are affected by breast cancer. It is the second leading cause of cancer death in women, and the average risk for a woman in the United States of developing breast cancer is around 13%. We've heard 1 in 8 women will develop breast cancer over their lives. And this leads to a pool of about 3.8 million survivors. We'd like to talk a little bit tonight about what that means, how to understand this, and what we as men need to do to interact more successfully with the women in our lives and as they go through their journey with breast cancer. We all think about cancers as an opportunity to make an early diagnosis, to try to find ways to prevent it. Breast cancer is developed, some cases early in life, but is often diagnosed by experiencing a lump on examination or through some type of imaging modality. If we develop a diagnosis early, it's an opportunity to treat it in a different way that's often more successful. So to try to address these topics, I'd like to bring to the panel a number of individuals. The first and the one I'm most appreciative of is Robin Coleman Houston. Robin's from Gary, Indiana, and grew up in Houston, Texas. She studied at Texas Christian University and has worked in the Texas Medical Center and a number of hospitals that I've actually worked in as well. She's a registered nurse and works in endoscopy. She's an active member of Xi Alpha Omega chapter of Alpha Kappa Alpha Sorority Incorporated. And she's married to brother Michael L. Houston and a proud mother. For the past 10 years, she brings an experience as a breast cancer survivor and advocate. I often follow her on Facebook as she's out doing another walk, out doing another discussion, and has a tireless passion for the topic and for the community. She brings awareness, education, and passion to breast cancer awareness, and is supported next to her by brother Michael L. Houston, who also grew up in the Texas area in Lamarck, Texas. He's a fellow member of the high school class of 1989, and also graduated with Robin from Texas Christian University. He's a member of Zeta Tau Lambda chapter of Alpha Phi Alpha Fraternity, and will bring a tremendous experience as a person who's also affected in their dyad. The third person I'd like to bring to the conversation is Brother Eric Taylor. Brother Taylor is a graduate of Auburn University, from which he received a bachelor's in science and nursing, and graduated from the University of South Alabama with a master's of science in nursing. He also is a registered nurse, and for the past 24 years, and has also achieved certification as a family nurse practitioner. He's worked in a variety of clinical and administrative roles, from critical care and primary care as a nurse and nurse practitioner, GI hepatology, telehealth, advanced practice care, and is the regional nurse council chair of the Advanced Practice Council. He's developed a number of presentations, research projects, presentations, and has worked in the Michael E. DeBakey VA Medical Center, where I actually trained. And he's currently a clinical instructor at the University of Texas Cizik School of Nursing, Family Nurse Practitioner Program. He is also a husband, a father, life member of Alpha Phi Alpha, and has served in a number of leadership positions. And he is the founder of Priority Male LLC, a men's health organization, where he really does a tremendous job providing educational services to the Houston market. It's really incredible. I'd like to thank all of them for coming today. I'd like to start just briefly with the way that we often talk about breast cancer from the female breast cancer perspective. What do men need to know? And I'm going to let Robin take the floor and ask the first question.
Okay, thank you so much. Just thank you for once again letting us be here tonight just to talk about this important topic to wrap up October Breast Cancer Awareness Month. So I'm honored to be here. So what men need to know is the question. So I think one of the things men need to know about breast cancer is that it's not an easy fix. When your loved one gets breast cancer, most men want to fix it. They want to fix it and they want to take care of it. They want to protect you. And they just have to know that when your loved one is diagnosed, it's going to be a journey. It's going to be a process. And so it's not going to be an easy fix to be in learning about the breast cancer and the whole journey of it. Also, like you said earlier, 1 in 8 women are diagnosed with breast cancer every day. And so it's not just a women's issue. If your wife is diagnosed, then more than likely your mother, your sister, your daughter, they will be diagnosed or, come in contact of having breast cancer one day. And so it's going to impact you as a male. And so you have to be prepared for all the emotions that go along with that. And also, you have to know that as women, when your loved one is diagnosed, we're stronger than you think we are. A lot of times we, like I said earlier, you want to protect your loved one, but we're stronger, we're fighters. And so we need you in our corner. That's one of the things we want you to know. We're going to fight, but we need you to back us up. And so as a breast cancer survivor, I get a lot of questions about, how did this happen? Did you not eat well, nutrition? What do you think about that as far as nutrition-wise and exercising? Do you think that makes a difference as far as with breast cancer or not?
Yeah, I'll let you take that. There are definitely prevention strategies that you can take that seem to reduce the risk of getting breast cancer. But I think that it's very, very important for everyone to understand that if you develop breast cancer, it's not anybody's fault. I think that it's fair to say that drinking no alcohol is better than drinking some. I'm from New Orleans, where alcohol is a significant part of the lives of many, many people, and it's well known for alcohol. But anytime you can reduce the amount of alcohol, I think that that's a positive. I think the other thing that is a positive that's difficult to do when you're from New Orleans is managing obesity. I grew up where food is part of everything we do. We have great food in New Orleans. I live in Houston, where there's also a lot of fantastic food choices and food options. Still not as good as New Orleans, but as a result, obesity is a problem. And I think that taking an opportunity to do that 30 minutes of exercise a day that we always talk about as physicians, to our community, is something that is very, very useful. And so that increased activity is something we should all do. And whether it's for cholesterol, heart health, diabetes, well, there are lots of reasons for that, but breast cancer is one of them. And also there are things that seem to, choices that we make as families that will affect the risk of breast cancer. Breast cancer is very, very sensitive to hormones. And as a result, anything that changes a woman's hormones will affect a woman's risk of developing breast cancer. So having children, using birth control or not, using hormone replacements after menopause. These are things that will affect your breast cancer risk. So I think it's important to discuss the risk and your personal risk with your physician. I think anytime you're trying to decide what to do, having professional guidance is something that we strongly advocate for, because your physician can assist with not just this decision, but also the ramifications of that as well. And I think that that's an important thing. Several members of my family were at high risk. One of my cousins had breast cancer, and so a number of my family members had a decision to make about should they get a mastectomy to remove their breasts before they ever even had cancer. That's a question that comes up sometimes, particularly when patients are in high risk families, and so I think that that's important. And an important question, and not one that's easily answered. So I think that that's really important to share with your practitioners. I don't know, Robin, what your experience was when you were speaking to clinicians, how open they were to having these discussions, how helpful. And what I'd love to hear from you is, what are the things that you think would be useful when you're talking to your doctors?
So just to back, as far as when I was diagnosed, I went to my well woman, went to have my regular well woman exam. And I, my doctor, he was the one that said, hey, I'm going to go ahead and schedule you for a mammogram. And at the time, I wasn't 40, I was 39 at the time. And so I kind of laughed because I gave him some pushback about it, because I said, I'm not 40. I don't need a mammogram right now. I could wait. But he's like, no, you're close enough. So I'm going to go ahead and schedule you. So I went ahead and did the mammogram, but I almost canceled that appointment just because as a woman, we're busy. I had 2 little kids. I was thinking, I don't need to go to this appointment. I could wait, but I went ahead and did that. And, a couple of weeks later, they called and said I needed to have an ultrasound scheduled. Now, this was my first mammogram. And so I did the ultrasound, and then they called back and said that they wanted to do a biopsy. And so I was thinking, why would they want to do a biopsy? So I said, oh, okay. So I went ahead and did the biopsy. And then they wanted, when they got the results, they said they wanted to schedule my meeting with the breast surgeon. And when they told me that, I knew something probably was not right. And I remember me and Michael going to that appointment, and he said that the biopsy showed something suggesting that it could be Dcis, which is ductal cancer in situ. It's an early stage of breast cancer. It's not invasive. It's cancer that's contained in the ducts. But they wasn't sure. They needed to do a lumpectomy, remove that area, and look under pathology, and then they would know. They said if it doesn't come back as a Dcis, then we're finished. We just remove the area and we're done. But if it does come back, then we have to talk about other options. And so I went ahead and I told the doctor, I said, look, I'm healthy. At the time I had just ran a marathon. I was in great shape. I said, I'm not claiming this. I'm going to go ahead. You can do whatever you want to do. It's going to be fine. But they did the lumpectomy, and sure enough, it came back as Dcis. And for me, I have a pre-existing condition. And the treatment for Dcis is usually a lumpectomy and radiation to that area. But because of my pre-existing condition, I could not get radiation. And so the suggestion, or what they told me that I needed to have done, was a mastectomy. And so, yeah, I did, hear out what the doctor was saying. I even went to get a second opinion, which is something that, women definitely should. If you're diagnosed with it, breast cancer, definitely get a second opinion, or just, look at all your options regarding that.
Yes. What a powerful story. Thank you so much for sharing that. As you talk to your community members, your sorors, do you find that they have concerns around going through the screening process, doing their own exams, doing mammograms? Do they tell you similar stories, or do you feel like you were by yourself in your experience?
No, I think most women do their go to their well women exams and try to do their mammograms on time, and they do their self breast checks. But I think the problem is being consistent with it. We may go 1 year and then maybe not go, or wait till it's too late, because as women, we tend to put others first. We tend to put ourselves last. Like I was going to cancel the appointment because I felt I was too busy, and that's something we can't do. We have to be diligent about, going to your annual exams, going to your well woman, getting your mammograms on time. But the most important thing I also tell women is to know your health history, know your family history, because that will determine also if you need to do our mammogram early. Do you need to get genetic testing? If you know, or you find out that all the women in your family have had breast cancer, then you may need to do genetic testing to see if you're positive for the breast cancer gene. And if you are, you might want to make decisions, like you said earlier, that may have a preventive mastectomy, and that's a hard decision to make, to have a preventive mastectomy, that you're having a mastectomy before you actually have cancer. But a lot of women make that decision because they feel like it's a ticking time bomb. They don't want to worry every year, when am I going to get cancer? Is this going to happen? They just rather go ahead and just get it done. And so in my case also, when they suggested the mastectomy, they just suggested, because it was just on one breast. But because I wasn't 40 at the time, I talked to my doctor. I also talked to my oncologist, and I decided to do a double mastectomy with the reconstruction, because one, I didn't want to worry every year getting a mammogram. What if it comes back? I was very limited in my options because I had a pre-existing condition. And so I wanted to be aggressive towards the cancer, because also African American women, cancer can be very aggressive and very detrimental to us. So I wanted to treat it aggressively. And so I did, I made that decision to do that. It wasn't, offered to me, but I said, this is what I wanted to do. And they were fine with that.
Brother Houston, do you think that there's a role for men in encouraging women to go through the process of doing their regular self-exams, getting their well woman exams, getting their mammograms? Is there something that we need to do to make sure that happens?
Yeah, we definitely need to encourage our loved ones to go through that process. And I think one of the best things that we can do is model that behavior by doing those things ourselves and making sure we are as healthy as we can be. And so that way we can set that example within our households. And then that makes it much easier for your spouse or your mother, your sister, whomever it might be, to follow suit. So I think that that's a very important key, for sure.
I appreciate that. Men often feel that they're invincible and that they've got really no need to get access to their health care. So I think I really like your ideas around modeling the appropriate behaviors and then supporting the women in our lives as they go through the process. That might mean taking on more responsibilities with family members, with kids, with other responsibilities to make sure that happens. That's great. Robin, as you go through and talk to women in the community, where would you tell them to start? You mentioned getting a mammogram. Like, how do they go about doing that?
Just, start with your doctor. I mean, that's the first place, your primary care physician, your OBGYN, just talk with them. But like I said, you have to get there. So you have to be consistent on, getting your exams done. A lot of times I do know people who will not go to the doctor unless they're sick. And so I'm like, you have to go, beforehand, to get your checkups, because a lot of times they can find things and prevent things from happening. So definitely start with your doctor. There's a lot of wonderful organizations, nonprofits in our area. Sisters Network is a wonderful nonprofit that is targeted to African American women. And as far as doing breast cancer awareness, that's a great organization. The Rose is also a great organization that offers mammograms whether you're insured or not. And they also have mobile units that will come to your area if you don't have access. So there's definitely ways to get your mammogram and to talk to people who know about that.
The access to healthcare is one of the things that I'm very, very passionate about, and I do believe that there hasn't been an equitable distribution of that access across communities. And so I'm very appreciative when I hear of organizations that are working in the community to bring access to the patients.
Yes.
So you mentioned that getting the diagnosis really affected your life and affected what you and your husband were talking about. We've heard from you. I'd like to hear more from Brother Houston. What was it like when you heard that your wife had a diagnosis?
Well, I mean, honestly, it was a bit shocking. Was not the news I was expecting to hear. But once that news settled in and it became a reality, we quickly realized that we had to adapt and adjust. And so one of the things that I found myself doing is really being a support for Robin. Mm-hmm. She was dealing with quite a bit just taking in the diagnosis and understanding what that meant for her, what that could mean for her going forward. Because of the limited options she had in terms of treatment, what that might mean for her going forward, and just in terms of her self-confidence, body image, things of that nature. And those things were things that I had to be cognizant of and understand that I had to be there to support her in every single way that I could, to let her know she is still just as beautiful to me, no matter how or what we go through this treatment process. She still is the person that I know and love. So it's very important for husbands, for fathers, brothers, uncles, whoever your loved one is, to let them know that you are there to support them no matter what. And then you have to, you have to act on it. You have to be there for them. You have to show them that you're going to be there with them every step of the way. And hopefully I did a good job of that. And I just, I'm just so thankful that she's still here today with me and my family.
She's definitely one of the stars of our experiences here. Do you find that it's a useful thing for men to go to appointments with their loved ones when they're dealing with this, going to spending time in the hospital, or is this something that you think that they can do on their own because they're so strong?
Well, I think that, so certainly women are strong on their own, but I think as a unit, as a couple, that is very important for you to be there at the appointments, at the in the hospital, whatever appointments that they may have, whatever treatment options that they have. It's important to be there, because not only do you want to support the fact that your spouse is strong, but you also want to let them know that you are there going through this with them. And they're not alone. They're not by themselves. They don't have to shoulder this burden all by themselves, even though they feel that they can, and in most instances they can do it. But they don't have to. There is that burden can be shared, and I think it's very important, and it makes a huge impact on their ability to recover and their ability to thrive through their treatment process, if the person who is closest to them is right there with them, sharing that load with them.
That's absolutely fantastic.
Mm-hmm.
In my house is a constant challenge trying to balance responsibility with children, with aging parents. When you're going through treatment, there's even more demands on time and energy, and how does one balance all that? I really need to know.
You lean on your support system. Definitely. We had a strong support system. I mean, my mother-in-law moved in pretty much at the time, because we had two small kids, and just Michael, he helped as far as with managing, my mother-in-law, as far as picking the kids up and doing things around the house, and then our friends would come, leave meals, and and we took it, we didn't shy away. And I tell, men, don't shy away from your support system. I know a lot of times you're like, oh, don't worry, I got it. I want to take care of it. But there's no groceries in the house and the kids are hungry. So if there's someone willing to bring you groceries, cook for you, babysit the kids while you go to appointments with your wife or your loved one, definitely take that support.
Yeah.
Outstanding.
Brother Dr. Narcisse, I also would like to chime in here too. One of the things that I would say, at least for us, is, whatever your spiritual foundation is, lean on that. You have to yes, truly lean on that. That was such a difficult time in our lives, And it was only because of our spiritual foundation that we were able to get through that time. Not only was Rodney going through breast cancer, my dad had prostate cancer. My grandmother had lung cancer. And this was all within a 3-month period. All three of them had their treatment, their surgeries. Rodney's dad was sick, so all of this was occurring all at the same time. And I was serving as the chapter president in my chapter. So, we have to have something that's bigger than ourselves to strengthen us when we have no strength left, because I had none. But something was I had something to reach to keep me going, and that for me was my spiritual foundation, which is my Lord and Savior Jesus Christ. So without that, we would not have been able to get through it. And then as far as men specifically, women are really, really good about talking to their sorors, to their friends, to their sisters, having an outlet. Men, we tend to bottle it up, and that only serves to add more stress to your life. And we need to have an outlet too. So I had one of my line brothers on here. Brother Taylor's one of my line brothers. I had areas, I had people I could turn to, but you have to identify those people who are going to be there and support you and pour into you positivity, and really look for those type of men in your life, other men, for sure.
Brother Houston, we often hear of someone who's close to us who's having a challenging experience. And I don't know that it's intuitive to every brother to understand what should we do and try to reach out to them. So if somebody in your chapter, somebody at work, somebody in your life who's important to you is either themselves going through cancer or their spouse, loved ones are going through cancer, what are the things that you would wish that someone would do to reach out? Because I don't think that every brother is going to be good at saying, I'm raising my hand, I'm having a challenge. Please go get groceries for me. I don't think that that's what many brothers are going to do. What would you like for people to offer?
That's a good question. I mean, I think the important thing is maintaining a connection. So, try to put it on your mental Rolodex to reach out to people on a consistent basis. Through that conversation, those things can come up during the course of a conversation. So if that brother is in need of, groceries or whatever it might be, that he may not want to just come out and ask somebody, but through your continuing reaching out to him, it may come up in the course of the conversation. It is difficult for men to raise their hand and say, I've got a problem, I've got an issue, I need some help. We're prideful, and we're taught to lead, and we're taught to be strong. But there are going to be times where you need help. And I think that if we just take it upon ourselves to make sure that we are reaching out to brothers, those who are in our circle, just check on them. Just check on them. Be consistent about that, and then those conversations will become easier to have, and a brother will feel more comfortable in asking for help.
Powerful words indeed. Powerful words indeed. I wanted to ask Brother Taylor a slightly different question. We spend most of the time, most of the month, seeing sports teams wear pink, and the whole world get interested in breast cancer awareness, and it really focuses on the women in our lives. But I think we heard a little bit about men getting breast cancer. I was wondering, Brother Taylor, if you could share a little bit of your insights on this topic.
Sure. Thank you all again for the opportunity, to our General President, Surgeon General, and Deputy Surgeon General. And it's not often you get a chance to share a platform with family. It's my line brother and my sister there, and I can remember this situation here, and we've been there to support them. And I got a lot of love for those two individuals. So, but yes, men get breast cancer too. We don't get it near as much as women do, but we do have issues when it comes to breast cancer. And I want to share my screen here and pull up some slides so we can get started here with the presentation. So let me know if we're good to go.
We're there.
Good. All right. So we got a few learning objectives I wanted to share with you here. We're going to discuss breast cancer in men. We're going to identify the signs and symptoms, discuss some risk factors and statistics, and learn about the screening methods, treatments, and prevention. And understand that breast cancer has no gender. Now, one thing I like to do a little icebreaker, because, this is a pretty deep topic, but I always like to kind of break the ice here. So this is a men's health screening, and Mike and Sister Robin have already alluded to this, and Dr. Dcis has already alluded to this as well. Men don't go to the doctor. What you can see here in this cartoon is the doctor standing there with his hands behind his back, cobwebs everywhere. There's probably an inch of dust on that table because men don't go to the doctor. Women are 3 times more likely to go than we are. And women talk in their circles of influence, share information, and from that sisterhood bond and conversation, lives are changed. But as Mike has already said, we men will bottle this up because of the masculinity piece and feeling weak. We don't want to share that, so we won't go. So now you got a lump. What do we do next? Early detection is the key. Now let's talk real briefly here about the female and male breast anatomy. And I want to point out a few things so you understand what we have in common. Okay. Now, as far as on the male breast anatomy, you see there we have the areola, which is the pigmented color of the breast, the nipple, and the ducts. Okay. Men also have lobules, as you see to the right on the female breast anatomy. There's a lot more fatty tissue there. They have ducts, areola, nipple as well, which we have in common, but they have more lobules, as you can see, than men have. Now, this picture doesn't do a really good job of showing the few lobules that men have, but I want you to understand the reason why I'm pointing this out, the ducts and the lobules, because you'll understand the cancers that develop in men based on those two anatomical findings. Now, let's talk about some male breast cancer facts, all right? And now, again, breast cancer is not just for girls. Breast cancer is rare in men. Less than 1% of all breast cancers occur in men, but breast cancer is about 100 times less common among white men than it is among white women. It is about 70 times less common among black men than it is among black women. And something that we know all too well when it comes to black people in this country, black men with breast cancer tend to have the worst prognosis. And the average age at the time of diagnosis is about 68. Depending on what source you're looking at, that age can range from about 68 to 72 years of age, but the mean is right at about 68 years of age at diagnosis. Now, what are some other key statistics on breast cancer? American Cancer Society, which is one of our leading cancer information networks out there, estimates in 2021 that 2,650 new cases of breast cancer will be diagnosed in men this year. Out of that, 530 men will die. With that, that gives men a lifetime risk of 1 in 883 men having the chance of developing breast cancer. Also, again, about 1 in 100 cases of breast cancer are found in men. So again, it's rare in men, but we do get it. So what is breast cancer in men? So breast cancer, basically, cancer in general is when normal cells just grow out of control. And breast cancer is when breast cancer cells tend to grow out of control. These cells form a tumor, and it can be felt with your hands just under the skin. And oftentimes it can be visualized with whatever imaging modality your doctor chooses to order. Most of the times it's going to be an ultrasound or MRI, or mammogram, but it could be more of a CAT scan and an MRI. The tumor tends to grow and spread to surrounding tissues, and this is called metastasis, where it spreads, and it can also spread to different distant areas within the body. So now, what are some of the types of breast cancer? And this is why I pointed out the anatomy on the first slide, because I want you to understand what cancers do develop in men. And Robin has alluded to this as well. Ductile cancer, which is the cancer of the duct. This begins in the milk ducts. Again, men have these same anatomical features in our breast, but they're not functional in men as they are in women when women have children. Okay. But for men, the most common cancer for breast cancer in men is going to be ductal carcinoma. Then you have lobular carcinoma. And this cancer begins in the milk producing glands. Again, men have these glands, but we don't have near as many as women have. But this cancer is often rare in men because of the few lobules that we have in our breast tissue. There are also a few rare conditions that develop. You have Paget's disease, which is like an eczema type presentation of the skin around the areola, and and there are a few other inflammatory breast conditions that men can potentially develop. But these cancers can be localized, which will be our carcinoma in situ, which is just in that area. It can be surgically removed, but then you also get invasive metastatic disease, which can, again, cause a lot of problems and will change the plan of care when it comes to that cancer treatment. Now, let's talk about some benign conditions that men often have that are more common than you think, and gynecomastia being number one. I wanted to put a picture here so you can kind of get an understanding of what this looks like, and you've probably seen it, maybe didn't know what it was called, but now you know. Gynecomastia is the most common disorder in men. It is caused by a hormone imbalance, especially in adolescent boys. Up until puberty, boys and girls have about the same amount of breast tissue, but at puberty, the girl's ovaries kick in and produce estrogen, which causes those secondary maturation characteristics to develop, and the young men's testicles produce more testosterone, which causes those secondary maturation characteristics to develop. And that is where the women develop more breast tissue than men. Also with liver disease, the liver plays a major role in the metabolism of male and female hormones. And if you have underlying liver disease, specifically from alcoholic cirrhosis, it can affect your body's ability to metabolize those hormones and can lead to the development of gynecomastia. Obesity, we all know all too well many of the complications of obesity, but obesity in men can blunt the effects of your testosterone, lead to higher levels of estrogen, which again can develop gynecomastia. Certain medications, and there are quite a few of them out there, but this one comes to mind because I've prescribed it a number of times. Aldactone or spironolactone is another name for this drug. If you have liver disease, you may be on this medication. This drug is notorious for causing gynecomastia, and you always have to alert the patients when you prescribe them that this has a potential side effect that may develop, and we will address it if it develops. Then the other concern that happens with gynecomastia is called Klinefelter syndrome. And this is where it is, they have it at birth, and basically they have an extra X chromosome. So it takes an X and a Y to produce a male and an X and an X to produce a female. In Klinefelter syndrome, they're going to have two X's and a Y, and they could possibly have more of the X chromosomes within that makeup. And with that, they're going to have low male hormones, which is going to have more of the female presentation because of what happens in the hormone cascade. Now, let's talk about breast cancer risk factors for men. All right. And again, a lot of these are very similar to women, and there are a lot of similarities when you think about breast cancer in men and in women, outside of it just being rare for men. When it comes to the cancer itself, there are a lot of similarities with the signs and symptoms, which you'll see later in the treatment itself. But for men, growing older, as we get older men, we get increased risk of not just breast cancer, but all cancers. But again, with a median diagnosis age at 68 is where we see most men that develop breast cancer at the age that they develop it. High estrogen levels, and this can be from a number of things, from hormones that you may be taking for other treatments. Being overweight also plays a role, alcohol abuse, chronic liver disease. And then I want to spend a little bit of time here on the gene mutation. Robin has mentioned this earlier, and it's the BRCA1 or the breast cancer 1 gene and the BRCA2 or the breast cancer 2 gene. This gene mutation increases your risk, especially for females, for breast and ovarian cancer in BRCA1. For men, BRCA2 is the one that we are concerned about. But this is where you have to know your family history. You know, while we're at those family reunions, you know, we're spending time. If there's someone they tell you in that family that you look like, and they're there at that family reunion, you need to sit down with them. And if they're open about their health, have that conversation about the history so you can be proactive about what may be happening in his health. If Uncle Willie, they say you look like Uncle Willie and he's there and he's willing to share, please talk. But most of the time, men, what we do, we're at the family reunion looking for shade and lemonade, and we ain't even trying to play spades instead of trying to figure out what's going on with our family. But if you knew the history of who had what, especially when it came to breast cancer, the genetic counseling that you might need to have based on the BRCA1, BRCA2 would help you go ahead and be more proactive about this and get ahead of this before you were to have anything to develop. Now, for men, the BRCA2 again causes increased risk for breast cancer in men, increased risk for prostate cancer, and also increased risk for pancreatic cancer. Now, radiation exposure is another risk factor for men. If you've had thyroid cancer or you've had lymphoma or you've had any external beam radiation to the chest, this also, again, increases your risk for breast cancer. Again, we talked about the family history, and on the previous slide, I talked about the Klinefelter syndrome. Now, what are some of the signs and symptoms? Signs and symptoms for breast cancer in men are going to be identical to that of women outside of the amount of tissue that, again, women have versus what men have. But in men, you may develop a small lump in the breast area. There may be some nipple pain. Your nipple may be inverted. You may have nipple discharge. It can be clear or bloody. You may have some scaling, some redness to the area, sore in that area for no reason. And then you may have enlarged lymph nodes in the armpit. Now, I want to share a story right here about the enlarged lymph nodes under the armpit. Now, I've been practicing for quite a while, and I've shared that breast cancer in men is rare. You don't see it often. In my years of practice, I've only seen 2 cases, and I can distinctly remember this patient that came in. He had armpit swollen lymph nodes, and he had recently changed his deodorant. Now, if you've had this happen before, I've seen it before. I've also had this conversation offline with a few brothers. But he was relating the pain that he was having with the swelling in his armpit to the new deodorant. And he was completely ignoring other symptoms that he was having. In my assessment, asked a few questions, found out that he had had a family history of breast cancer and a couple of his aunts. And then also in my physical exam, noted that he had on that side where he had the armpit lymph node swelling, he had some changes to his breast tissue that he had kind of ignored or thought was just a normal part of aging. Referred this guy. We had the conversation about what I thought it was and what we needed to do. Referred him, and he ended up coming back with breast cancer, and he had to have a mastectomy. But again, we need to be aware of our body. We need to pay attention to what's happening. And men, we need to be able to have that conversation openly and mention these things to our doctor. But he was more focused on what was going on with his armpit and completely ignoring what was happening with his breast tissue. All right, next, let's talk about some diagnosis and treatment. As you can see, this brother here is having a mammogram. And yes, men do get mammograms. And as you can see, the brother in the bottom there in the screen, he has had a mastectomy. You see the surgical scar. But when you go in to have this assessed, let's say you find a lump in your chest, you have a doctor that you are going to see, you have a good rapport with, you go in and you express the concern. They're going to start out with a basic clinical breast exam. And it's just a methodical way of looking at the breast tissue and trying to see what abnormalities are there on top of what you may be presenting with, because sometimes you will notice in the lymph node tract in that area, the adjacent area, you'll notice that there's also some abnormalities there. So we'll start with that. You'll likely have a mammogram to get your baseline and see where you are with some basic blood work. From there, we will determine what additional imaging you may need. And then this will likely lead to some additional diagnostic workup, whether it be from a fine needle biopsy, where they take a needle, go directly into the tumor and get a tissue sample to send to the pathologist for review, or you may go to the OR for a minor outpatient procedure to have an incisional biopsy, where they go in and actually take a small incision and get a piece of the tissue and send it to the pathologist. Once we get that back and we know the stage and grade, that will dictate the treatment path that you take. Now, I did not include the stage and grade in here because that would take a lot of extra time, but there are 4 stages of cancer, 0 to 4. And the rule of thumb is the lower the score is on the stage, the better outcomes you're going to have. And the higher it is, the more likely it is going to be more metastatic, which may have some challenges with treatment. So once the stage comes back, more than likely for men is going to be a mastectomy if it becomes confirmed that it's positive for breast cancer. And then based on those findings as well, we will determine if you need additional chemotherapy, radiation therapy, and possible hormone therapy. But this will depend on your stage and grade of your tumor at that time. Now, as far as surveillance, Again, breast cancer is so rare in men. There is not a set screening protocol like there is for women at a certain age, where men should have a mammogram or have some imaging done. And even after the surgery, it will be dictated based on what kind of treatment program or plan you went through and how successful the surgery is. So surveillance will be a conversation that you will have with your surgical oncologist and any other doctors that are treating you, and they will let you know what you need to follow during the course post-treatment. Now, can breast cancer in men be prevented? There are a number of things we can do, and Dr. Dcis mentioned this in a couple of slides previously. We need to get to and stay a healthy weight. Let's face it, Siri and Alexa are running our lives and ruining our health. Yes, I said it. You come in the house, Siri do this, Alexa do that, and we're not doing anything. We don't turn on the TV, we don't turn on the light, we don't adjust the air. What do we do anymore? And most of us are on couch arrest today, and you wonder why we're having so much cardiac arrest. We got to get off our laurels and get moving. So get to and stay a healthy weight. And the only way to do that is to not live a sedentary lifestyle. We have to be physically active. It is recommended you have 150 minutes combined of some type of physical activity per week. However you choose to do it, it's on you, but you got to get moving. And again, avoid or limit alcohol. Let's be realistic. This really is more so focused on the higher upper limits of alcohol consumption, not the one drink that women may have every time they have a drink, or the 2 drinks that men will have. That is not a significant risk factor, although alcohol consumption is, but it's more so related. We see higher incidence when people have a heavy history of alcohol use, especially with those that have underlying liver disease or alcoholic cirrhosis. And then tobacco. If you can cut your tobacco out, that is also another risk factor that you can reduce, you can avoid, and this will help, again, mitigate the risk associated with breast cancer in men. So now I wanted to share some things with you that some of us may not have been aware of. Some of our male celebrities that have privately, secretly, quietly suffered with breast cancer for many years, and we look at them on TV and never knew. Here we are. Richard Rountree. I'm a late 70s baby, so I know this guy is Shaft. You know, who is the man? That's him, Richard Rountree. He was diagnosed with breast cancer in 1993. He had a double mastectomy and chemotherapy. He's alive and cancer-free today. For those that watch TV, you've probably seen him on some of the shows that he's on. But when he was diagnosed, he wanted to keep this a secret. He didn't want anyone to know, because he questioned his manhood, because he was like, men don't get breast cancer. You know, he's of that generation. And he was like, I don't want to share this with anyone because it may affect my ability to get future acting roles. He hid this for many years until I forget the exact time that he came out and talked about it, but he's more open about it now than he has ever been when he first was diagnosed. All right. Next celebrity. And this is our fraternity brother. This is brother Senator Edward Brooke. He was the first African-American senator. He was diagnosed in 2002 after pain under his right nipple, which he thought was from a pulled muscle. This brother was an avid gardener. When he was not dealing with the business of the United States in his role as a senator, he loved to garden. I mean, this was something like a favorite pastime of his. But in 2002, while gardening, he noticed that he had some pain, went to see the doctor, ended up having breast cancer, had a double mastectomy, and he was alive until his death in January of 2015 at the age of 95. Then we have this guy right here. And again, you know, I can remember this because The Price is Right forever sketched on my brain. Rod Roddy, come on down to The Price is Right. I can still remember him. He had his own way of doing things, but he was The Price is Right announcer for 17 years. In 2002, he was diagnosed with colon and breast cancer and died shortly thereafter in 2003. There's still some mixed information as to which cancer was primary, but it's likely one of them metastasized to the other area, but we're not even sure. But he did not last long after his diagnosis. Here we have Peter Criss. If you are familiar with the Rock and Roll Hall of Fame band Kiss, you know who this is. He is the drummer for that band. He was diagnosed in 2007 after finding a lump in his left breast after a workout. He ended up having a mastectomy, He's alive and cancer-free today, and he is one of the outspoken advocates for male breast cancer awareness in the United States today. Then we have Ernie Green. He was a fullback / halfback for the Cleveland Browns and from 1962 to 1968. He's one of the oldest living NFL players at 83 years of age. He was diagnosed in 2005. He found a lump in his chest, told his doctor about it, and his doctor was like, man, it's so rare in men, you don't need to do anything about it. And again, we know that from the statistics. However, he went and got a second opinion, had a mammogram and a biopsy, ended up he had breast cancer, ended up with a mastectomy and chemotherapy. He's alive and cancer-free since 2006. And we all know this young man right here. He is the father of Beyonce Knowles, and he is well known, Mr. Matthew Knowles. He found blood on a white t-shirt some years ago and never thought anything about it. He was like, man, I'm taking these new medicines, so it's probably something related to that. Typical man will find another excuse to divert that to and say, oh, it's nothing. He ended up talking to some family, and he revealed that his maternal aunt and 2 cousins had died from breast cancer. So people in his circle encouraged him and said, man, you need to go get that checked. He went and had a mammogram. He ended up doing the BRCA gene testing, the genetic testing, and ended up also having a bilateral mastectomy. Now, the risk factors that he had at the time that he could draw the conclusion to was for about 8 years, he did work for the medical division in Xerox where he sold the Zero radiography. And at that time, when he worked for them, the Zero radiography was one of the frontline leading modalities for the diagnosis of breast cancer. Go figure. So now we all know this guy here as well, Montel Williams. And Montel Williams revealed that he underwent a double mastectomy for breast cancer as a 19-year-old member of the United States Marine Corps. He had a tumor or an area in his chest that was likely it was benign, but it may have been associated with gynecomastia. He went in and they decided that he needed to have a double mastectomy. He had the procedure, and then when the pathology report came back after the procedure, it confirmed that the tumor that they found in his chest was benign and not cancerous. And this is one thing you need to know, men, is that most of the tumors that we men will have in our breast are most of them are going to be benign, but you still need to be proactive and go get it checked. And the last thing we need to focus on, men, is let's focus, and ladies and gentlemen, let's beat breast cancer. Robin here is a survivor, so we know what can happen when you put your mind to it, you follow the doctor's order, and you have the great support such as she had with Brother Houston. We can beat cancer, and fighting is our only solution. Know that cancer doesn't discriminate. It affects all of us. I don't care what walk in life you're in, mother, father, sister, brother, doctor, friend, it doesn't matter. It affects all of us, and it takes all of us collectively together to fight and win and beat this breast cancer. And yes, this is not an ad for the gym. Yeah, dude is on swole. He been working out. He been killing it in the gym. But just know, men, just because you look good like this doesn't mean that you can't get breast cancer, because anyone can get breast cancer, men included. With that said, if you're in the Houston area, I'm Brother Eric Taylor. This is Brother Marcel Thompson, our fraternity brother as well. We have a beautiful practice here in the Bel Air area, located at 4914 Bissonnette Street, Suite 101, Bel Air, Texas, where we focus on men's and women's health and wellness. Feel free to check us out. Come through and see us. If you're looking for some doctors, providers that look like you, come through and check us out. We'll be happy to help you. And if you don't remember anything, man, ladies and gentlemen, I want to leave you with this. Always remember that it is easier to stay well than it is to get well. Hashtag priority male. You heard it here first. Now, if you were having issues with your health, it's from a men's standpoint. I want men to make sure that we do our part to go in, be seen, get screened, and don't forget to mention it. Because if you don't, men, you show up like this. And this is what I don't like seeing. That's why I do priority male. Well, men's health is the priority, because I've seen so many men come in on death's door when we could have done something, been more proactive about managing their health. But men, do what you need to do to be here for those that love you and need you most. Man up and take control of your health. Taking care of yourself doesn't make you less of a man. Your family needs you. The world needs you. Our community needs you. And I want to encourage you, men, again, to focus on wellness, focus on prevention. All the time, men will take better care of the car or the truck than we will this body. Now, if you're on social media, Pick your poison. I'm all over the place. I do mostly Instagram, Facebook, and TikTok. I'm a very busy man, so I don't do a lot of the Twitter and the YouTube. But if you need information on men's health issues, also I do speak on women's health issues, feel free to pick a poison and follow me. I appreciate you. If you have questions, you can also check us out at the website, www.prioritymailllc.com. You can call us here at the office, 832-356-9717. I got a lot of these resources here from the United States Preventive Task Force, CDC, American Cancer Society, and I'm happy to share those with those that may need that information or have additional questions. Thank you again.
Well, I don't know what was more powerful, the passion that Robin and Brother Houston spoke with, or the knowledge that Brother Taylor brought to us. But I know that this has touched my life in a unique way. I've learned a lot. I hope that everyone out there has learned something, and I hope that you'll take action. And whether you're supporting your loved one or whether you're getting checked yourself, do take your health seriously. Prevention is the key. We're all clear on that. I want to thank, first of all, my soror, my coworker, Robin, for sharing such a personal part of her life with us and so with so many. Her husband, Brother Houston, for supporting her and for sharing and allowing her to be here and allowing her to do what we've done here tonight. Brother Taylor, I'm thankful that you come out and brought knowledge in a new perspective, in a new way. We can see why you're doing education and healthcare on a professional level. I'd also like to thank Brother Lonzer, who makes all this happen, and Brother Sterling, who you heard from a little bit at the beginning, who's the inspiration for the series. This series will be back next Thursday, 6 p.m. Central, 7 p.m. Eastern. We'll be talking updates on COVID. It's been a topic of all of our lives the last year. We've got new ideas, new discussion. We'll be back next week. Thank you so much. Join us. Have a blessed night. Stay safe.
Appreciate you.
Thank you so much.
All right.